you know the time?
Yep.
Feel the job?
Yep.
Beautiful. So we have a kind of a marking pen. So that's going to be about where we start.
You can give him that one. I can always give you another one.
He has markers. I'm not,
Thank
I'll
you,
just
sir.
take it by.
We're going to want to start this.
Did you get that 10-10? Don't take that. Did you get that?
So I want this. So I want
No,
this
I
to
got it.
end up here. So we're going to go kind of in this angle here to get it to that spot. But I want you to be able to use the pad here. Okay. So, all right, cool. All right, let me go. Can I have like a just like a paper towel or something? Yeah. Cool. Okay. All right, get back.
I am gonna work my way. Is this where you want me, Carol?
Yes, please. No, Michael, I gave you. Kind of look at me, that camera for a minute.
Yeah.
I meant to pull a 10-10. So that you don't want that way, correct?
No, please.
All right. Thank you very much. Thank you. Thank you.
How you doing, John?
Okay.
Okay.
John, you're amazing, man. All right, so
Is the time out?
Now we can do it.
do a timeout.
Okay, this is Mr. John Sagers here for a left axillary nerve, shoulder peripheral nerve stimulator, permanent placement under ultrasound guidance. Do we agree on that?
We agree. I agree.
He has no allergies.
Thank you.
Received his antibiotics?
Yes,
You see that 2 grams of
it's
the
still going.
It's still going.
Uh-huh.
All right. So, John, what I'm going to do now, my friend, is I'm going to clean the area off here. Okay.
I'm gonna,
This procedure's done under full sterile technique.
Carol, I'm increasing it just a little bit.
Everybody just make sure that this is not being flashy.
Oh, okay.
Yeah.
No problem.
Put this down here. Does it look all right?
All right.
Okay.
Thank you.
How's that?
All right, John, I'm going to try not to cover your
It
face.
was 11:50, we did the time now.
You don't have any place to.
Yeah, I'm just putting it. Okay.
Since you're waiting for this, I always find it kind of like,
Here you go.
not too bad, right? Cool. All right, I'll keep going. Yeah, we'll put a sheet down. Cool.
Prep was better, John?
Door prep.
Your prep.
Yeah, I feel like he's. But you help me with this thing. All right, go ahead.
Yeah.
2% lidocaine with
Maybe here, maybe a U shape.
Can you pull around this way?
Great. Beautiful.
That's why I wanted to have more cameras, isn't it?
We'll utilize here to wrap around like that.
Okay, so you don't want to do it
No, you perfect like this. I can actually see the stimulation. Before I actually prepped him, I actually used the ultrasound to remove localize. You know what? I think he's fine. Honestly, you okay like that, John? I'm fine like that. I don't think we need no. I'll do. I'll take one more towel.
Can you move it over here?
That's 360. I guess we're trying not to cover you.
How you doing? How are you alone?
that I gave you.
All right, brother. So, can I have the
This is
ultrasound here? And the ultrasound rubber. And then actually, you know what, Cindy, or Karen, do me a favor. There's the, where did I put that hoop?
You want the unstrong?
Yeah, you can start.
Here we go, put it inside.
Give me a little squirt of that. You might have to like catch a bit, you know, like mustard. Beautiful, cool. All right, now, do me a favor. Can you drop me now?
I'll let you do it because I don't want to screw up. Yep. That's fine. Perfect. Was it? Yep. That'll be perfect.
Okay. And then, where are those rubber bands? Good. Perfect. All right. And then I'll take some of that sterile food.
Do you need more?
Good. All right, perfect. Come on, man. All right, so I'm gonna be local. So again, what I did here is I localized the
Carolyn gave me this kit, so when he says he's ready-
axillary nerve. What I did initially was I localized quadrangular space, which is comprised of teres minor, the surgical neck of the humerus, the long head of the biceps, and the subscapularis. What I did is once I localized that, I basically came at, I turned the transducer to a more lateral position, and then placed the Doppler, localizing the circumflex artery. Once that the artery was localized, which you can see pulsating nicely right there. Basically made a mark about 5 centimeters medial, and we'll get started. So that's going to be my target zone. So if I could have, so I'm using 2% lidocaine with epi. And then you're going to feel a little pinch, okay? So what I'm going to do is I'm going to try to localize the superficial skin here. I'm going to localize down, be real careful not to anesthetize down to the nerve itself. So we will have to stimulate. And what I don't want to do is stimulate. If we do end up anesthetizing the nerve, we will not be able to stimulate. There you go, my friend. Thank you. Can I have the 11 blade? So what I'm going to do here is utilize the 11 blade to make a
That's your style left.
stab
That's your
puncture.
Yep.
And one of the things that you really got to be careful of when doing this procedure is to ensure that you don't move the ultrasound too much during the procedure. Here you go, Michael. Because what happens is if you move the ultrasound too much, that nice view that you had changes. And then all of a sudden you're now not knowing exactly where you're aiming.
There you go. Take that
Yeah,
white
what I
part,
did
and
there.
then
So
carefully
I'm
control
trying to
the right.
localize that position.
You're right here, with your right hand? Yep. Yep, keep going.
So, Colleen, do me a favor.
Yep.
Time it out. Can you just hit the,
Which one?
right there?
This one?
Yeah. so you know you've been here too long, it's almost like the machine's telling you, dude, you're going too slow.
You won't hurt it. Go ahead, pull it off.
Um,
There you go, Michael.
All right, man, can I have the
Stim probe.
stim probe?
And nope, there you go. Just one.
Thank you, sir. So we're gonna place the stim probe through the puncture site. John, you're gonna tell me if you feel any discomfort, okay? I'm gonna try to use some more local. You can see the probe coming across here. Again, it's important to gauge your depth here. And remember that you're trying to utilize the needle and change the position of the needle to, or the probe itself, to accommodate your ultrasound. You really don't want too much give, too much movement of that ultrasound probe, because what can happen is, again, you're changing your entire picture when you use that.
And don't forget, Dr. Joe,
I think we're pretty close there. So what I'm going to do is I'm
I
going
do have
to.
it available.
Okay, great. No, I think we're good.
Okay.
So I'm going to ask Colleen now to give me the stimulator. We're going to try to stimulate.
Yep, we're gonna grab one of those yellow cords. White is sterile, goes to him, and the yellow goes to me.
Man, that is a nifty task.
Oh, that's a pain, isn't it?
If I could, you know, that is like fancy. So in this, so what you could do here is.
Okay, so you get white, I get yellow.
I'm gonna clip this here. I keep white. She gets yellow. There you go. What I might ask you to do, what I might ask you to do, Michael, is I might ask you to gently, I'm gonna hold on to, if you could hold that. So, this is where having, maybe by a little help from your friends. Alright? Colin, have you heard that song?
Yeah, isn't it the Beatles?
You feel your arm move there? You
Yeah.
got a really nice motor contraction here.
0.7.
0.7, great, perfect. All right, so we're gonna disconnect this. So we're gonna make sure that nothing moves now. So what I'm gonna do at this point is I'm gonna get the dilator.
Good, Michael.
Listen, Michael. Michael.
He's on it.
Michael's no joke. Honestly, I don't even need computer.
I don't need to be here.
Yeah, you're the star of the show.
I don't need to be here.
So what I'm doing here is gently feeding this down. Again, under the ultrasound, making sure. And what I want to do here is make sure that the tip is just
Passed.
past.
Okay,
You okay, my friend?
Yes.
No, Bucko. Now again, how's your pain during this? You okay?
Thank you.
Right there, where it is. Coming back. Good job. How you feeling?
Okay.
Good job. You're doing great.
you're doing great, John, okay?
All right, I'm gonna test this again, okay?
Are we past the black?
Yeah.
Black falling out? Okay.
All right, hold on there. Okay, reconnect. Now hold this tight. Make sure that. Okay.
Okay.
All right. Real good contraction.
Are you feeling that in your shoulder?
My arms jerking it up and down.
Okay. Okay, I think you're right on it.
Good, perfect. All right, hold that again, Michael. Oh yeah, there's a nice contraction.
Okay.
0.5, beautiful.
And we need to overshoot that dilator just a little bit.
Yeah, that's where it is, right at the tip.
So overshoot it just a little bit more.
Perfect.
Okay.
All right, good. So what I'm gonna do now is I'm gonna remove the
Stim probe?
stim probe. Okay.
Counterclockwise and black.
And then, Mike, what I'm gonna need you to do, my friend, is I'm gonna have you turn the probe here. Okay, you see this thing right here? Not the full probe, like that kind of screw part. Yep, right there. And then we're gonna pull that out. Good.
Now he's ready for that lead.
And I'll take the lead.
It's the one that you turn the little red, right there.
Beautiful. So again, you're getting the gist here. Place the lead head, and I should height, I'd like to see the tip of that come out, which I do right there.
Stop right there, and we'll stop, you wanna test
Stop
again?
right there. We're gonna test one more time.
Black on
You wanna
black?
have the, once the black meets the black, you wanna have, you wanna stop right there. Put the stimulator on again. And we're gonna turn that on.
Are you feeling anything, Michael, or John?
No, I can't tell.
See, I feel it here.
Okay, cause I'm not sure we're connected.
Oh, here. So, Mike, why don't you push the wire to this wire? Sure. Yep. Nope.
It must not be leading out of the sheet,
You pull it out.
or advance it, one or two, but yeah, it's not giving me, or we were connected, we're not getting any numbers, so we have a disconnect here somehow.
Maybe we'll get some more. You can see it on the ultrasound, it's got this.
Okay, well,
I feel his arm.
if you feel that we're in the right place, let's just go ahead and.
I do, I
see.
feel it.
Okay.
Yeah. All right, Mike, pull that off of there. Yep, pull the weight off. And then what I'm gonna do at this point is, I'm going to pull the,
So how far in are you, because if you've gone past the black, okay, no, you have not put the anchor yet.
no, so come back.
Nope, so you want to put it back, so you're, like, black on black,
Mhm.
okay? And then you want to start to hold that lead loader and retract the sheath. So the lead loader doesn't move as you're pulling the sheath back.
Good.
That will deploy the anchor. Okay. Okay, that'll work.
All right, then. So your lead is in. So now it's just a matter of
Waiting to heal and then.
get that puppy over to here, and then we're good to go, okay? So I'm gonna give that to you, Michael. I'm gonna place this over here, get this out of the way. Now what I need to do is, I'm gonna measure this out to where I'd like it to end up, which is about there. So if I could have so what I'm trying to do is about 2 to 3 centimeters beyond the,
One to two if you want, but probably you want it further.
yeah, I'm trying to get it further out just so you can get good contacts out of it because his other shoulder's not that good.
You okay,
So
John?
you really want to, just have keep in mind what the other anatomical issues your patient has, because that will affect how easy it is for them to put the pads on, how easy is it for them to utilize the machine, because at the end of the day, it can be the greatest modality, but if it's annoying or difficult to utilize, like from a practical standpoint, they're not going to utilize it. So it's really important at this point of the procedure to really think about some of that stuff. All right, so we're going to go, what about here?
You can
Now, if I can have some local.
Okay.
across the whole thing, I didn't mention that.
So first go through the localized segments.
You did great, John, you're almost done.
And I'm just do localize exit point. Good job on that. We'll localize the other direction as well. Just because I really don't want my friend here, because he is under local anesthesia only. And that's really how I recommend you do it. All right, my man, can I have the 11 weight?
And then the next he's gonna do is the stylet, which is the pointed. So you've got the stylet and the tule, which are right in between the stem probes, right in between both of them. So you don't need the stem probe, yep, or you need the
I
stylet.
just need the stylet. The stylet is the one with the hub on it.
This one?
No.
There's
No.
one with a hub and then there's the one that,
Sorry,
just like
the
this,
laser pointer.
the other stimulators we do.
Okay, you're gonna grab that, yep, that's gonna be the second thing, but the
Right.
first thing is the one with the pointy edge. You have your fingers on it, just this, right there.
Oh, okay.
Yep, stylet and tule.
Again, always know where your needle tip is. you do is, again, you're utilizing this, so you need something to feed the lead back. So you place the hub on top. Now again, be careful not to, taking care not to stab yourself, not the other end. Once you come through, and you see the lead, that's when you
You okay, John?
remove.
Yeah, fine.
Michael, he may use some forceps here.
And what you're gonna do is you're gonna feed. You're gonna feed the electrode through. And as you're feeding the electrode through, carefully trying to make sure not to smush the thing.
Yeah.
Through. There you go. John, you're all done, buddy.
Oh, good.
Okay?
I know I'm gonna feel it once it,
Yes, sir.
once it wears off, all the,
You did great. So what I'm gonna do now is, I'm gonna place we're gonna clean the area. I'm gonna place a little Dermabond on there. And then we're good to go, bud. Okay? Not too bad, right?
no. I'm gonna be sore, I'm saying after
Did you already
that.
go?
We're gonna give you some
Sorry.
medication.
No, it's all right.
We're gonna make sure we cover you. So it's not- Good job. Have that Dermabond.
It's coming, sorry.
Dermabond coming up.
And I forgot to watch the clock. Did anybody know what time the first decision was?
Yes.
Oh, thank you.
11:55.
55? Okay, cool.
Are we,
Thanks.
procedure end? Not yet. Yeah.
My nails are dressing up.
He's not gonna get addressed.
No dressing. Someone has done dermabond.
What's that, crazy glue?
Cool. Yep.
You got it, that's exactly what it is.
Okay.
Good job, buddy. That's it. Okay.
Fastest implant to date that I know of.
What's that?
Sorry.
Fastest implant to date that I
Yeah, I
know
know.
of.
Really? Oh, cool.
Okay. Really good,
John, you did awesome, my
though.
man.
You did good, thank you.
Awesome.
It was-
Look, man, you had the hard part. You sat still, you chilled.
No, this not at all.
Good job, man. So that's gonna dry up there. You did fantastic. You know what we could do, actually, because he's got, can I have what's that called? The backpick? Not backpick. No.
Steri strips?
Take it
No.
over.
Not take it. What the hell is it? Oh my God. I'm gonna break for it.
I won't do that.
The shiny stuff. The shiny on one end, the
Telfa?
Telfa.
Oh.
Good, just.
Cindy Wales.
Thank you very much.